Good morning, colleagues. You're very welcome to Culture and Engagement and Healthy UCD's For Men Health webinar series. I'm Mark Simpson. Today, I'm delighted to be joined by Robert O'Connor, Director of Research for the Irish Cancer Society, and our own Professor Patricia Fitzpatrick, Subject Head for Public Health in the UC School of Public Health, Physiotherapy and Sports Science, and a Consultant Epidemiologist with the National Screening Service. Patricia has a number of questions to start today's discussion. And if you have a question, please use the Q&A function at the bottom and we'll endeavour to get through as many as we can. So basically today's webinar is a discussion between Robert and Patricia. You're welcome to participate again, as I said, by using the Q&A function. So I'll hand over now to Patricia and we will, thank you very much, Robert, appreciate it.
Great, thanks very much, Mark. Okay, well, I'll kick off asking you maybe how big a problem is cancer, and particularly in men in Ireland at the moment?
Yeah, and just before I get into that, Patricia might just echo what Mark said. We'd love to hear questions, and I guess
yes,
we have the
absolutely.
option here of kind of doing a lecture or doing a kind of an engagement piece, and I suppose we felt that it might be more effectual. And there are major challenges for us, I suppose, in communicating and empowering men to impact their trajectory, their health trajectory, and especially their cancer trajectory. So I suppose some of the things I'll talk about and that I think you'll talk about as well may surprise and shock people, and in particular the scale and size of a cancer issue. More than 1 in 2 of us, so that includes half of men, half of the people on here will be diagnosed themselves with an invasive cancer. As you know, Patricia, more than that will actually get a cancer diagnosis, so they will maybe get a non-invasive skin cancer. Probably 3/4 of people will get that over their lifetime. And unfortunately, for a variety of reasons, both the types of cancer and in some cases the late presentation, because men can be maybe shy about going to their GP with symptoms, there's a higher mortality. So more men proportionately will die from their cancer than women. And I suppose one of the things I always like to point out, which again I think some people find challenging to appreciate, every one of us, so everybody on this call is born with a risk of cancer. Some people indeed may have already had a cancer at some stage in their life, or they maybe have a cancer. But no matter what we do, we all have that risk. We're all born with it. And I suppose there is an element of the chance as well as the things that we can do ourselves to impact that. So cancer is a big challenge. It's a growing challenge. The numbers increase by about 3% per year. So what that means in a decade is the numbers more than, increased by 30%, by a third. So it is a big challenge.
Yeah, so the Cancer Registry have done projections over the last number of years and they've shown increasing numbers. But a lot of that's because we have an aging population though, isn't it?
Absolutely. And I suppose the numbers, when you look at the differences, about 10 times as many 70-year-olds get a cancer diagnosis as 40-year-olds. So around about 50, 55, there's a major inflection in the numbers. And you can see that when you present those. So thankfully, cancers are very, very rare in children. And then as we get a bit older, and certainly the 40s and 50s, we start to see that. And I suppose the major things that we can do then are around being, and most people I think here will be in that sort of age group. The major things we can do then are around, taking control of our health, engaging in screening, and being attentive to signs, symptoms, and signals that, may or may not be cancer, but need investigation.
So what might be the kind of if you think about one of the big cancers in men, so what might be the signs of bowel cancer that people might need to look out for?
Yeah, so I suppose there's a wide variety of different signs and symptoms, and they really reflect, and I suppose we all tend to think of things happening just as cancer, but often we have other conditions going on in our bodies and stuff like that. And it can depend how advanced the cancer is. And some cancers can be sneaky, for want of a better term, so they can build up over time, and hence the kinds of signs and symptoms then may be more overt. And sometimes things can be caught a little bit early. So things that I would worry about, that I've seen in family members or friends and stuff like that, would vary from night sweats, ongoing fatigue. And I think any health issue that's ongoing for a period of time lumps, pain in particular areas. And I think, you asked specifically about bowel cancer. I suppose that the main things that I would be looking out for in myself would be any unusual bleeding into the stools. And there are lots of reasons that can happen. People can have, believe it or not, varicose veins in their bowels and that, and piles, so they can give rise to blood. But if there's ongoing blood in the stools, that certainly needs investigation. In many cases, there will be a benign explanation for it, and some other procedure may be needed. I suppose pain and discomfort that isn't usually there, or major changes to bowel habits would be certainly a red flag to me. You from your own experience, you may come up with some other ones, but
they'd be the big ones, all right. Yeah. And it's the key thing, I suppose, is the key message there is that people need to just be mindful. And lots of these symptoms and signs can be due to other causes, but until you get something investigated, you won't know. So it is really important to present, and actually anything that's ongoing for a while, any length of time, needs investigation.
Yeah, and I suppose some of our own research kind of indicates that, the people that do better are the ones that are attentive, that they've got access to healthcare, access to their GP, they have a good relationship of trust, that they, don't feel strange by maybe picking up the phone or that. And partners can play an important role as well. And there's a fine line, and both of us are in this situation, fine line between nagging and positive partner encouragement. But partners can have a positive influence in encouraging and making people feel comfortable to talk about these issues and go to a GP. And as I said, in many cases, the GP will be able to give a test or make a referral. There'll be reassurance, and other things may be found as explanations. We don't really, and I know some of the folks on the call here are working on better blood tests and things like that. But at the minute, we don't really have great general methodology for picking these things up. You can't go to a doctor and get a blood test annually and know whether or not you'll have cancer. So being attentive to these signs and symptoms is really, an early way. And I suppose one of the things that we probably need to mention, and maybe an inducement and encouragement, is there can be a massive difference in outcome the earlier one picks up cancer.
Yeah.
And I'm not sure that the public maybe understand this. And bowel cancer is probably one of the best illustrations of that. Mm-hmm. So we've bowel screening, which is very effective, and bowel screening prevents some cancers. So it picks up precancerous lumps, sometimes these growths that can happen, picks them up, and if they're found and removed, that will not turn into a cancer. If caught early, almost all bowel cancers are curable. So the registry data would show that 19 out of 20 cancers caught in stage 1 are effectively cured, so that they're certainly 5-10 year survival as well. It's 19 out of 20 people. While unfortunately, if it progresses to stage 4, less than 1 in 10 will be alive. And that's a massive difference. And that, that's the kind of empowerment that we want to give to people in this particular community, into men, to be able to change the trajectory of the impact of cancer. So
even, for a lot of cancers, when they're picked up early, so apart from survival, there's also kind of morbidity. And the morbidity, the disturbance of your body is much less if you have an early cancer treated, as opposed to having a later cancer, more extensive cancer treated. Even if you're cured, you may have some changes to your body that you prefer not to have. So it's much easier if you have a cancer detected early and things are sorted out quickly. So just on that note, we might just, you mentioned bowel screens, we might just pick up on that there, because that's the one screening program that we have for men at the moment.
I suppose there's 3 national cancer screens: cervical and breast, where bowel works for everybody. And I guess it's a free test. It's quite a simple test. It's available for folks over the age of 60. Correct me if I'm
at the moment it's 60 to 69, and we may in time be able to extend. At the moment, we're trying to catch up with COVID issues. Improve colonoscopy capacity, but at the moment it's 60 to 69 year olds.
Yeah, and just so folks know, because they may be too young for this to be relevant to themselves, but they may have parents or grandparents indeed that this may be relevant to. It's a very simple test. So you get a free dipstick and you dip that into a small sample of your poo and you send it off. in most cases, it will come back negative, but a percentage of people, it will detect a very small amount of blood. It's a very sensitive test, and that is an indication for the need of a follow-up, which will typically be a colonoscopy. So the initial test is actually really simple, really straightforward. The problem that we face is that it has low uptake in Ireland. Just less than 4 in 10 men of the eligible group take up the opportunity for this free test. And if you do the calculations, if we got that up to 100%, we would probably save several hundred lives each year. So it's, you know, it's challenging, and bowel cancer is very common. It's maybe 12%. It's maybe 1 in 8 of all cancers. And as you quite rightly pointed out, very treatable in the early stages with, you know, relatively little consequence. Treatment for late stage is very consequential, and you know, if successful, we may be talking about people having a colonoscopy, so you know, some bag essentially to take their poo out. So there's that. I see a question in from John there as well, which might be worth addressing.
Are there ways to be screened if you don't have easy access to a GP? So if we're talking about bowel screening, that's free to everybody. And if you're uncertain, if you're on the register for bowel screening, if you're approaching 60, you can go on to the bowel screen website and you can check your name if it's on the register. Or if you can't find it, you can contact the program and ask to be put on it. Because in bowel screen, their names are brought in from, you know, self-registration plus a lot from the Department of Social Protection. So you can self-register to get on the bowel screen listing, but you may well be there and you'll be called when you're 60. And, you know, I suppose most people as they get older, Robert, you know, really should have a GP, have someone that they go to, you know, and for things like blood pressure and all sorts of other things, it's important to have a GP, particularly as you get older.
And that's why I think John's question is very pertinent. And I suppose in modern lifestyles, we tend not to be in with our GP unless, you know, we've got an issue or whatever. And it's not just cancer, you know, in particular, blood pressure is a major determinant of life expectancy and a major modifiable determinant of life expectancy. So I suppose if you don't have easy access to a GP, firstly, as I said, there isn't a general kind of cancer screen. There isn't a blood test that you can do. I'm not personally a believer in these, you know, executive health screens and stuff like that, unless you've got specific risk factors, specific indicators, maybe from your family history. So unfortunately there aren't, and I suppose being attentive to the signs and symptoms is an aspect of screening that we can undertake ourselves, that we can, you know, pick those things up and then decide we might be in and visiting a GP or some other healthcare professional, maybe get the blood pressure checked, maybe report any signs or symptoms. Skin would be another one that I suppose people need to be attentive to. We have high rates of skin cancers, and there's a variety of them. Many of them can be relatively easily treated. Some of them may progress to melanoma if not treated, and that can be obviously very serious. And our skin in general, I mean, we're a multicultural community now, so people have different skin tones, but certainly the paler skin people will have a higher rate of those. So there isn't really, John, to answer your question, but being attentive to those signs, I suppose actioning them and doing something about them. And it's funny, obviously I interact with my own GP or whatever. I've never yet heard of a GP dismiss somebody, you know, coming in with an issue. They'll usually investigate it. They may be able to provide reassurance and say, no, that's a normal lump for someone, you know, that's had that condition or whatever you might have. But it can be very reassuring, and I suppose it can also put a mark for a trajectory in life for one's health. Thanks for that question, John.
So you touched on skin cancer there. So that's a growing problem in males. Males have actually caught up with females in terms of the numbers of skin cancers. What would be the best way to prevent skin cancer then?
Yeah, so
what should men be doing?
Yeah, and as I hinted at, skin cancer risk is not uniform within our population. So those who come from a Caucasian, from a very pale white kind of background, don't have as much melanin, and melanin provides quite a lot of protection against strong ultraviolet light. So if you work a lot outdoors, if you maybe travel abroad in sunny areas, if you've had certainly a history of a lot of sunburns, or if you've got lots of moles, you're at higher risk of one of those converting into a skin cancer. And the kind of things then that we need to do, it's really important to get out and be active, but we need to be careful, and especially at high intensity parts of the day, that we cover ourselves up, that, you know, we've got a hat, we've got, you know, loose clothing, we've got sunblock on. And if I do a lot of water activities, so I use a very particular sunblock to try and make sure that, you know, I've afforded the maximum protection, bearing in mind that I'll be kind of washing a lot of it off. So I think, you know, being in the shade and so on, but getting out and being active is a really important part of life as well. So no one's talking about, you know, those aspects of it.
Yeah. And then some of the places people forget to put on sun cream, particularly for men, you know, they put on a cap and they think that's great, I'm covered. Tips of the ears are really important to just remember, where's the sun going to hit, you know, and maybe your tip of your nose isn't going to be covered by your cap. Check what's going to be, where the sun's going to be hitting, even if you're, you know, you're covered a lot, but you might have some parts that really do need a little bit of sunblock. Really important on those.
Yeah, and those are actually the areas to keep a closer eye on as well. So, you know, for example, if you get scabbing on the tip of your nose, on the tip of your ears, and you'll often see that in men in their 70s, those need to be followed up, because they may be a particular type of skin cancer called basal cell or squamous cell carcinomas. And, you know, in those areas, maybe the backs of the hands as well, that's where we see maybe builders, farmers, outdoor workers, gardeners, you know, tending to get those, because those are the areas that over our lifetime maybe have been hit with more of the ultraviolet that's in sunshine, including in Irish kind of latitudes. You don't have to travel abroad. And indeed, we can see that disparity across Ireland. So the southern part of the country has a higher propensity for skin cancers than the northern, and it's thought in part that reflects more sun exposure in those areas.
Okay. Now, another thing people might be interested in is kind of, you know, if I have a family history, what does that mean for me? Or are there genetic things I need to be aware of for male cancers?
Yeah, and I suppose the area of genetics and the contribution of genetics is changing on a daily basis. It's changing very significantly. And I suppose there is a bit of a breakdown. So there are some cancers where we thought maybe they ran in particular genders, you know, so maybe breast cancer or whatever, but actually further analysis is indicating that there's a lot of crosstalk between those. So I suppose things to be keeping an eye out on the genetic situation would be a preponderance of particular types of cancer in families. So let's say, you know, the father, the brother, the grandfather, and the father may be having bowel cancer. Early development of cancer is certainly something that needs to be discussed. And we see that commonly with things like maybe prostate cancer. I have a good friend who had that situation. His dad had prostate cancer. His brother in his mid-40s was diagnosed with prostate cancer. He went off and he got checked and he had prostate cancer. It was silently sitting there. He caught it early, it's gone. So I suppose age, and as we get older, as I mentioned earlier in our chat, there's a greater likelihood of developing cancer anyway. So, you know, I'd certainly be attentive with first degree relatives below the age of 50, so first degree, so immediate relatives, having cancer. I'd be paying attention if there's, you know, multiple ones. Their families tend to be smaller now, so it can be a bit more difficult to pick these things up. And those need a conversation with someone who'll be able to, you know, better advise, and, you know, maybe able to advise as to whether, you know, genetics need to be undertaken or specialist screening. So it may be that somebody needs maybe their PSA, their prostate-specific antigen.
Or also, there's some family history kind of screening services in the country for people who have a family history of a particular family history of bowel cancer. When you have a strong family history, there's
exactly, and so that's separate to general public screening.
Exactly.
It's a different process, and your GP will be able to get you in on that, and it can be very effective. And also can give a lot of reassurance that people, you know, with certain familial traits like Lynch syndrome would be a well-known one, which gives preponderance of that BRCA. So the Angelina Jolie gene, so we know that contributes to breast cancer and ovarian cancer risk, but we now know that it also contributes to prostate risk. And that's what I was saying, that it may not just be the male family members and that. And hence checking these things out can have an impact on your health or my health, but also on our children and other relatives, and reduce their risks if these things are picked up.
Okay, so I just see there's another question. Let me have a look.
Yeah, I see a question there from Bill. As we were in the month of November, what advice would you give men in relation to prostate cancer detection, and when would be the best time to start PSA testing? So that's a loaded question.
Absolutely.
And a really good one. And good to see you, Bill. PSA testing. So this has been a kind of a controversial one. So PSA is a protein that is expressed by part of the testes. And in normal situations, there should be extremely low levels in our bloodstream. In some, but not all prostate cancers, as the cancer evolves, it leaks some of this PSA into the blood, and we can pick it up by blood testing. Now, the challenge is that historically, there would have been a recognition that simple blood testing of the general population tended to give rise to a lot of worry, a lot of false positives, because your PSA can be elevated because maybe we're cycling or other damage. But I think the latest direction in this is that certainly if there's a family history of prostate cancer, you should get checked usually in your early to mid 40s. It's a very simple test. I've had it myself. So blood test, you come back and you get a result. If there's a particular kind of I suppose in general, more widely, men certainly in their mid 40s to 50s should have a baseline PSA, and this will, I suspect, over the next couple of years, come in as part of the general standard of care. And then it's really looking at the trajectory of that PSA. So if your PSA is below a certain level, which will depend on your age, really you probably don't need another test for maybe a decade after that. And if your level is intermediate, you may need a more frequent test. And if your level is elevated, you'll need a retest fairly soon. If it confirms a high level, you will need it investigated, and there'll be examinations or whatever. So this is, I suppose, where the technology and the application is changing a little bit, and where there's a kind of a balance between over testing, giving rise to worry and potentially over treatment and that, but actually an opportunity to prevent what can be a devastating cancer. And about one in 7 men in their lifetime will have a prostate cancer diagnosis. Although the news is good, because more than 90% of them won't die from their prostate cancer. They live out their life, maybe needed kept an eye on and that, or it can be removed. It just depends on the stage of the cancer. So hopefully that addresses, but I suspect Bill was well aware of the answer in that result.
Yes.
Thanks for that, Bill.
No, it's an important one to talk about, because people are, everyone has heard of PSA probably, or lots of people have, or a test for prostate. Yeah. They're just wondering why.
And I think people need to have maybe a chat with their GP. GPs are very au fait with these things. And, really building a trusted relationship with your GP, I suppose, is a good thing for life. They say, always have certain professionals, have a good mechanic, have a good dentist, have a good GP, have someone that you can trust, have the conversation, who knows you, who will know, in years to come, when you're coming in with something that, there is actually a worry that there's a basis there, that and that's, trust in these things. So I think a conversation with your GP is probably the main thing around that, and GP will know your age and be able to, look into some of those other things with a few questions to help guide you on the best direction.
So we're coming towards the end of this session. So we might just finish up with maybe, Robert, your kind of take-home messages on prevention, and then secondly, if people want some more information, where can they go?
Yeah, so I maybe give that first. So I suppose the Cancer Society is a national cancer charity. We have a lot of different supports to provide. So if you go onto our website, cancer.ie, you'll see all of those different services and supports that are there. And 1-800-200-700 is a free number. You'll get through to a nurse who'll be able to address yours or other family member kinds of issues, and obviously any aspect of social media. So reach out. There's great people there. My colleagues are fantastic at that. I suppose the take-home messages are, build a relationship of trust with a healthcare provider. Be attentive to changes in your body and action those changes. So as I said, those signs and symptoms, unusual bleeding, unusual pain, unusual lumps, unusual tiredness, these things going on for weeks or months, night sweats, loss of weight when you're not actively doing something. Obviously if you change your diet radically or you take up marathon running, you might expect those things. But if you're going through, like the rest of us, going through your life as the way you have, major changes to your health, or major changes in some of those things really need to be actioned. I can't overemphasize the opportunity screening provides for bowel cancer, and I think we will see that in PSA. And I suppose in our children, make use of the preventative measures that we know. Moderate your alcohol, moderate the amount of calories you take in. There's no magic anti-cancer diet, but the amount of calories. Vaccination is really important. HPV doesn't just, for example, cause cancers in women, it causes them in men.
Yeah.
And men give them to women. So, vaccinate children. So HPV and hepatitis B vaccines are cancer preventing vaccines. And as you mentioned, Patricia, be careful in the sun. Skin cancer related issues are just so common. And it's, pardon the pun, a growth area. So those are things that we can do. And so we're all born with the risk of cancer, but we can impact the trajectory and the likelihood of getting that cancer. And we can really impact the likelihood of it having a negative effect on our life or potentially killing us. So that gives us a lot more control when maybe sometimes we feel these things are quite random and out of our control. And that's how we can kind of stack the odds. We can't guarantee marathon runners get cancer the same way as anybody else, but we can influence the chance of getting a cancer in the first place and of it having an impact in your life.
Some of those things that you talk about, having a good diet, a healthy diet, we're not going to talk in detail about that now, but having, a healthy diet, lots of fruit and vegetables, that's really good for cancer, but it's also good for heart disease. It's good for lots of other things. So some of the things you'll do will also benefit you in with other diseases as well.
Obviously the climate things as well. So more vegetables are usually easier sourced locally and all of those other good things. So these are things that one can do, and these small changes can have that wider impact in a number of aspects. And usually, we didn't mention smoking, but obviously if you do smoke, try and cut down, try and quit as best you can, get support with that.
I might just add in there for UCD staff, two things. If you're a smoker, ProCare have 30% off in the university pharmacy for NRT. And as well as that, look at the e-zine. We advertise stop smoking courses in Vincent's Hospital, which occur several times a year. They're now moved online. They're very easy to access. So there's plenty of opportunities to stop smoking if you work in UCD. And if you don't smoke yourselves, please let your colleagues know who smoke, know that there are supports there for you in UCD.
Yeah, quitting is really difficult. And I suppose what the data shows is that if you get support on it, it's much more likely to be effective and you stay off them. But it really is difficult. And I don't think we necessarily give credit to people for, the difficulty, etc. And cigarette and tobacco smoking, nicotine addiction is very serious, but tobacco smoking is one of the biggest single avoidable causes of cancer. We talk about lung cancers, but there are a range of mouth, head and neck, oral, throat cancers. It increases the risk of breast cancer in women. So there's a big opportunity.
As well as that,
it's never too late. Even up to people being diagnosed and going through treatment, we know that giving up smoking at that late stage has an impact on life course, life expectancy, and overall health. So,
as well as that, giving up smoking will help your partner, spouse, people you live with, your children, whoever lives in the house with you, because secondhand smoke is becoming an increasingly recognized problem as a cause of cancer and heart disease. So you'll be doing everyone around you a favor if you can manage to give up smoking. Okay, I think we're probably close to the end now. I think we just have one more comment there. Does stress add to your risk of getting cancer? Just finish up with that one.
That's a really good question, David. So there's two answers, which kind of might seem a little bit contradictory, but hear me out. So stress in itself is not a direct cause of cancer. So and many cancers will take, certainly in adults, will take years, if not many years, up to a decade maybe, to go from precancerous cells to an overt symptomatic cancer. But there's no question that some of the things around stress certainly can increase our risk. So for example, if you're living a stressful environment, you may tend to take in more calories, or your diet may not be great. You may be more likely to smoke or take in too much alcohol. So things around the stress and around the stressful aspects of your life can contribute to a number of different aspects of health. Stress itself is not a cause of cancer, but as I say, so I'm kind of answering in two contradictory ways. I'm sure you've kind of picked up. So, you know, what we can do and what we can control around those things can be important in our overall health. And that's, so, you know, trying to reduce those things will have benefits across a wide range of things, which may figure into cancer. But stress itself is not a trigger per se of cancer.
Okay, great.
Super.
Thanks, Robert.
Patricia, can I just come in and thank Robert and yourself? Most interesting discussion, and I think a great way to bring it to life. So I really appreciate your time, both of you, on that.